Hi friends, Laura here with Breastfeeding House Calls, and as promised in this video we are going to discuss breast infections, how to prevent them, and how to treat them. So let's talk about the two types of infection that breastfeeding parents may experience. One type is a fungal infection, also known as candida or as thrush, and the other type is a bacterial infection commonly called mastitis. However, mastitis is a medical term for breast inflammation, so it could be that you hear thrush and bacterial infections referred to as mastitis. Just know that commonly mastitis is used to refer to a bacterial infection versus a yeast infection, which is just commonly called thrush or nipple thrush. Now let's start with thrush. How does one get a yeast infection on their nipples? So if you're not careful during breastfeeding, it can actually be quite easy to get a yeast infection on your nipple. One of the most common postpartum causes of thrush is the use of antibiotics in either you or your baby after birth to treat or prevent other birth-related infections. Nipples that are kept wet for too long during the postpartum season can develop thrush. Thrush can develop first in a baby's mouth, and it can be passed back and forth. While not all injured nipples will develop thrush, nipples that are cracked or scabbed are more susceptible to developing it. One of the best ways to avoid thrush is by correcting a grumpy latch. Thrush in a baby's mouth usually looks like white patches inside the cheeks or inside the lips that don't wipe off. Often babies will have thrush on their tongue. If you see a thick yellow or white coating that won't wipe off with a dry washcloth, it could be thrush. It's important that even if they don't have obvious symptoms, that both of you are treated at the same time so that you don't pass thrush back and forth. So call both your doctor and your baby's doctor. Also, making sure to disinfect your home environment is important. So disinfecting things like bottles, dishes, laundry, common surfaces that you share with others, doorknobs, faucets, toilet seats, bathtubs. And don't forget to keep older siblings away from baby's passy, sippy cups, or bottles so that they don't get thrush. And lastly, wiping baby's hands a few times a day with a fresh, wet washcloth will help. Some of the symptoms on a breast include itchiness, stinging, burning. Those are all common words used to describe what thrush feels like. And sometimes you can get thrush in the breast, and parents will describe that as shooting lightning strikes in the breast. Clients experiencing thrush will report feeling their nipples 24/7, whereas maybe latch pain will go away right after latch is corrected. Thrush can actually feel worse between feeds. So what are things that you can do to prevent thrush in either you or your baby? Some parents will take probiotics during the birth and breastfeeding season. Also, if you're getting an antibiotic already, ask your doctor about the possibility of developing thrush from antibiotics and see if they'll co-prescribe an antifungal in case you need it. Needless to say, keep nipples dry, and when you're finished feeding, make sure that you wipe out your baby's mouth with a wet washcloth. If you see your baby's bum start to develop a diaper rash, try to take care of that as soon as possible because a lot of diaper rashes are actually yeast. Needless to say, use good hand hygiene so that you're not passing the thrush back and forth to surfaces or from your baby to yourself. Rinsing your nipples with warm water will help even if you're not experiencing thrush symptoms. Avoid using breast milk to heal your nipples because breast milk actually contains a ton of sugar that can make the yeast worse. Speaking of sugar, it's recommended that you reduce your sugar intake while you're experiencing thrush. Since we all know that too much sugar, too many starches can actually make yeast worse. How do you treat thrush? As with any type of infection, make sure you bring your healthcare provider into the loop. Now, a lot of parents will discuss with their healthcare providers things like using over-the-counter yeast infection creams that are intended for vaginal yeast infections but can work over the areola and nipple. Talk to your healthcare provider about dosing. If you do use an over-the-counter vaginal yeast infection cream to treat your nipples, make sure that you're wiping them off. Something commonly used for yeast infections you may read about online called gentian violet. It's effective, but make sure you talk to your midwife or doctor prior to using it. And of course, there are prescription antifungal pills and prescription antifungal ointments. Now, if you're just suspecting thrush, you can do the warm water with apple cider vinegar soaks that I mentioned in my last video. Those soaks are intended to soothe you, not necessarily to cure a full-on yeast infection. Okay, so now let's talk about a bacterial infection of the breast. While the term mastitis means any inflammation of the breast or mammary tissue, in the context of breastfeeding, it typically refers to a bacterial infection. So mastitis is caused by a few things. The obvious ones related to breastfeeding would be not washing your hands and touching your nipples. Germs could be introduced to your breast through untreated latch injuries, unresolved milk plugs, and rarely and not necessarily related to breastfeeding, but someone else's saliva on your breast. Now, what are the symptoms of mastitis? Mastitis feels anywhere from a throbbing tenderness to a full-on feeling that a truck hit you. One of the most common symptoms of mastitis is feeling like you're starting the flu or like you have a full-on flu, body aches and pains, full out malaise, tenderness of the breast, swelling of the breast, throbbing, and fever. A side note on the difference between a milk plug and mastitis, and we're going to talk about milk plugs in a future video. Milk plugs are usually a small area that you can feel and you can say that right there hurts me, whereas mastitis tends to be a larger part of the breast, throbbing pain with actual warmth over it. Many times you can see mastitis by looking in the mirror. You'll see a reddening of your breast. Sometimes though, mastitis can occur deep inside the breast, and while you can't see it from the outside, you feel it by massaging your breast. Many parents with mastitis, especially untreated mastitis, will go on to develop a fever. Fevers are your body's way of trying to fight the infection off. However, a fever that goes too long can indicate that the infection is progressing. Because I have seen mastitis go from 0 to full-on abscess, I would encourage you that if the symptoms are not going away by basic things that you do at home, call your doctor or licensed prescriber. So some things that you can do to help treat a mastitis infection when it's early at home is nursing your baby in different positions during each pump session. You can also pump, sometimes with a larger flange that'll help to get more milk out, and massage while you're pumping, massage also while you're breastfeeding. You can also prime your immune system by drinking a lot of water, trying to rest as much as possible, probiotics or other vitamins that boost your immunity. However, if things don't improve within the first day, or if your symptoms increase quickly, be okay with calling a licensed healthcare provider who can prescribe. If your infection is happening during a weekend and you can't get a hold of your healthcare provider, mastitis is commonly treated at urgent care centers or emergency room. When you pump, don't be surprised if you see thickened or yellow milk leave your breast. That is normal and is usually the infection draining. However, if the coloring of the milk is darker, green, or brown, it's time for a trip to the ER. It's important to know that even after you've been treated for a mastitis infection, if your symptoms have resolved but you still feel a mass or a lump in your breast, put that on your doctor's radar. My hope is that you will do everything to prevent or to catch and treat an infection early. I'll be leaving links with more information about mastitis and thrush down below. If you haven't subscribed to our channel, make sure you do that. If you like this video, you found it helpful, share it with other families in your network. Thank you.